So, you receive the marketplace notice and you're not sure what you need to do now, or what you need to know about healthcare reform. There are lots of people telling you about the new law, and even more people who want to give you an opinion. But this video is not about them. This video is about you. Many of you are familiar with reform provisions already in place. Number 1, you can cover your dependent children until the age of 26, even if they are married or don't live with you. 2, no lifetime limits on coverage. 3, 100% coverage for preventive care on most plans. 4, no pre-existing limitations for children under the age of 19. And 5, a 10% excise tax on indoor tanning. Okay, well, some provisions aren't as popular as others, say an HSA pre-tax dollars on over-the-counter medications unless you have a prescription. 7, the threshold for the itemized medical deduction has been raised to 10%. 8, if your employer has an FSA, the new annual cap is $2,500 for medical expenses. 9. And finally, if you work for a larger employer, you will notice the cost of your medical care reported on your W-2. You won't pay taxes on the benefit, but you will see the new box. But that's all in the past. 2014 is the big year for healthcare reform. All individuals, with few exceptions, will be required to have health insurance or face a penalty. For 2014, the penalty is $95 per adult, $47.50 per child, up to $285 for a family. For 2015, the penalty increases to $325 per adult, $162.50 per child, up to $975 for a family. And in 2016, the penalty will be $695 per adult, $347.50 per child, up to $2,085 for a family. The exchanges are open. Oh, and just to keep it interesting, they are now called marketplaces. Premiums for health insurances are the same in and outside of the marketplace. However, individuals who do not have access to affordable health insurance may qualify for a premium subsidy. A subsidy is when the government pays for part of the health insurance premium. Generally, an individual earning less than $46,000 per year or a family of 4 earning less than $94,000 will be eligible for a subsidy. However, if your employer offers a plan which meets minimum value and the premium for employee-only coverage is not more than 9.5% of your household income, you have access to affordable coverage and you will not be eligible for a government subsidy. In 2014, your employer's plan will let you know if it meets the minimum value requirement on the summary of benefits and coverage. You can determine your affordability by taking your salary and multiplying it by 9.5%. Example, $35,000 times 9.5% equals $3,325. If your cost of employee-only coverage is equal or less than $277 per month, your plan is affordable as defined by ACA. Health reform tips. Pre-existing condition limitations will soon be a thing of the past. However, this won't take effect until each plan's renewal. So if you switch employers, save your HIPAA certificates of coverage through 2014 just in case. Most small employers will not be rated based on medical conditions going forward, but insurance companies can rate on smoking status. Call the Georgia Tobacco Quit line for a free kit to help. 1-877-270-STOP. Large employers will still pay premiums based on medical claims. Use your preventive benefits. Ask your doctor about generic medications. Be a smart health consumer. So, are you an employee or individual who would like to stay up to date on healthcare reform as well as get tips on being a smart consumer? Well, like us on Facebook or follow us on Twitter. Or are you an employer who is bummed your consultant doesn't provide creative, relatable videos like these? Well, now you can. Enter your information and one of our incredible team members will reach out to you. This video brought to you by your friends at Intrepid. Visit intrepid7.com to learn more.